Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the
In
internet.
our opinion, of course, Bob.
Okay, today we're going to talk about, Brad, is how to get your knee straight after you've had a total knee replacement.
Sure.
Now, it's always usually one of two issues, isn't it? Trying to get it bent, which we did a video on already,
Yeah.
and how to get it straight. So we're going to jump right into this. First of all, congratulations on having your knee done. Most people are very happy with it after it's all said and done, aren't they?
Right, the first week or two they were thinking about it.
Yeah. All right, this is the knee involved. The first one, and this is a very common one, you're just going to find another chair or a stool. A chair might be too high. You might
Yeah.
want to start off with a stool.
Mhm.
And obviously you're going to start off, and generally it is at this bent angle here,
Yes.
isn't it?
Yeah.
And I want to make sure that you know that you shouldn't be in a recliner. In a recliner, you're leaned back like this, and there's not as much stress on the hamstring. So you know how when people do a stretch, Brad, they lean forward like this and stretch the hamstring? You're going to want the same thing. So in other words, be in a straight back chair.
Mhm.
Don't be in a recliner. Put it up here, and you're going to let gravity do its thing. I like to tell people to see if they could do this for 5 minutes, 3 times a day.
Yeah.
And I tell them if it starts to hurt too much, go ahead and give yourself a break.
Sure.
Just bend it up a little
Yeah.
bit. Now, after a while, if this gets to be too easy, you can actually add some weight to it.
Sure.
And what we use, Brad and I, is called, and this is something you can do at home, is the weighted pillow. Brad, you want to show?
You take a pillow, and what we were tossing around before was just some cans. I guess Bob likes his pear halves. And you don't have to have pear halves, so you can use a can of anything, pork and beans, shrimp, applesauce,
Corn.
corn. And this happens to be green giant corn, but you put a couple of them in there on each side, so it's gonna be like a saddle.
Now, that's a lot. You might want to start with just two,
Yeah.
one on each side.
So you'll see,
You just put it
Right.
right across, and that's adding a good 4 pounds of weight, I'm sure. At least 4 pounds, because there's 2 on each.
right,
Right.
well, it depends how big the cans are, 12
Right.
ounce, 16.
Sure, but plus the pillow. But
Sure.
this puts some stress on there. I mean,
Right,
So, and again, if this gets to be too much, just give yourself a break.
Yeah.
And go right back into it. Now, the goal here, of course, if your right knee or your opposite knee is in good shape and normal, that should be all the way straight. So you can see how far you are from your goal.
right,
So you want to get this all the way down like that. So that's where you're starting.
Sure.
That's where you want to end.
you bet.
All right, that's exercise number 1. Number 2, Brett.
Just put your
Oh.
leg back up there. One thing I like to do with people is if their knee's getting real sore and you're stretching it hard and you want to give it a break, just
Oh,
go like
sure.
that, and that can really take a lot of stress off. It's more comfortable.
That's another one that you could maybe finish up that way.
Right, put your cold pack on,
Yep.
and so you're comfortable.
And Brad was saying that, by the way, earlier when we were talking, is that even the cold pack will add weight to it too, and it's a good time to do that,
Right.
so. All right, Brad, do you want to do the one where you lay supine and put your foot up on here?
Supine.
Laying on his back.
Okay.
Or sitting, you can long sit too on that position, can't you?
Now I'm gonna lay down. I think I get some of these vegetables out of here. Those are cold, Bob. You must have had them in the car.
I did. We're in Minnesota and it is cold today. It's November, but
November.
it's cold November.
All right, here we go. So, laying down or sitting, here's the knee that was done. Well, actually, I'm going to do this knee. If you had your right knee done, you're going to go up, and this is what you don't want to do. It's going to feel comfortable, but it's not going to do anything to take the bend out of your knee and get it straight. You're going to have to slide that towel roll
By
down
the way,
to
all
your
we did here
ankle.
is you can take a beach towel or a couple beach towels and roll up. It actually can even be bigger than this if you want.
Yeah. Oh, and I even feel a stretch on there now, and we're going to stretch there, and I can feel my hamstring stretch a little bit there. If you would lay down, then the hamstring stretch will not be there, but you will still get stretch on the knee joint itself.
And I would say the same thing on this. You could shoot for 5 minutes, Brad.
Yep,
And the same thing on this. You could put some weight on it.
you better believe
It's just
it.
another way of going at it. If you're kind of stuck with one way and it's not helping anymore, you're going to want to try one of these other ones.
Sure.
That's what we do in the therapy clinic.
Yeah,
we
we just
keep. For some reason, some work with with some people and others with others. So.
Right.
Oh.
Okay, yeah, so yeah, just leave it on there 5 minutes, take what you can, Sometimes you can vary it, go back to here, give it a break for a minute, then go back to here for a few minutes and stretch it.
All right, with you in that position, Brad, or why don't you go ahead and flip over, we'll go ahead and show the last one, the prone hang.
Oh.
Or laying on your stomach, and you'll put your feet off the edge of the bed.
This one's pretty aggressive. If you're usually a younger person, I'll do this on. I won't do it on someone too old unless they're really active and pretty healthy in other respects. But you're gonna lay like this.
So I actually even have them sometimes lay with the knee on.
Do you?
To start off with,
Okay.
yeah.
I guess it all depends on how comfortable
Yeah,
it is.
if that's really aggressive to have it off. I mean, but yeah, you're gonna let gravity now pull it down. And of course, this is another one where you can actually put some weights on there and make it go further.
That's, yeah, but be careful. It's pretty, if it hurts a lot, don't put any more weight on it. It can be aggressive. I had one person I did this with and it got him real sore, so we never went back to it.
Yeah, I've had people that worked with, and I've had people that was too aggressive. Here's a ankle weight. This is just 2 pounds, but I'm gonna put that on there, and you gotta keep the leg straight so when you don't grab it.
Yeah.
Okay, and you're gonna let it stretch out.
So, if it starts up here and again on this, 5 minutes is gonna seem like a pretty long time.
Yeah,
You're
it
gonna
might be
happy.
too long.
Yeah.
You can give yourself a break on this one by bringing it up, can't you, Brad?
Yeah.
Or bringing the other one over.
Go over and give it a break. I'll give it a break and then go back down. And again, like this one, the other one, you can compare this foot, the good leg here, to this one. You wanna get so they're even.
Right.
Are you gonna get there? You may not. You may get pretty close, and that might be adequate.
And that may be good enough, yeah.
Mhm.
All right, that's it, Brad.
Yes, fixing knees. What is this? 700,000 total knees done in the United States last year, was it? We looked that up once.
745,332.
Quite a few of them.
All right,
Take care.
take care.